Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey there, I'm Dr. David. Welcome to the show. I've got a great guest here, a friend of mine. His name is Dr. Angel Garcia. He's a physician here in El Paso, sports medicine specialist, one of the best in the Southwest, certainly the best in El Paso. And I'll let him tell you more about all that. But I just want to welcome you to the show. Thank you for listening. And welcome on here, Dr. Garcia. How are you?
Good. Thanks for having me.
Yeah, absolutely.
Appreciate it. So, like he said, Angel Garcia. Was born in Puerto Rico, moved to El Paso when I was about 5 years old. Been here since then. Went to Bel Air High School, part of the health magnet there, first graduating class. After Bel Air, went to Baylor for my undergrad, got my degree in psychology, and then from there I went to San Antonio for med school, University of Texas Health Science Center, San Antonio for medical school. When graduated there, came back home for residency at Texas Tech in family medicine, and then after completing the residency in family medicine, stayed at Texas Tech for a fellowship in sports medicine to better serve the patient population that I was interested in treating. What drew me to family medicine was more of the being able to see the whole family, treating the whole family. But I really love the musculoskeletal system, working with athletes and dealing with those type of issues and trying to provide a different perspective than was provided by surgeons. Not that, surgery has its place, but for the vast majority of problems can be solved without surgery. And I was wanting to be able to help my patients more, so I decided to do the sports medicine fellowship there at Texas Tech.
That's awesome. Were you one of the first classes there at Texas Tech? Because they're pretty new.
For sports medicine, we were the first class for sports medicine there at Texas Tech. They had different programs throughout the state, but my wife and I really want to stay here in El Paso with family.
Cool, awesome. I love El Paso. So you've got your own company here, and that's just where we're at right now. We're recording from Dr. Garcia's office. So tell me about your company. What's the name and where's it at?
So when I left residency and fellowship, I really wanted to just kind of go out on my own, not work for the man. So we opened up a clinic, El Paso Center for Family and Sports Medicine. Initially, we were at another location on Trevino, but we recently just moved. We got a new building, trying to expand our services. So now we're on George Dieter and Physicians, right next to Diagnostic Outpatient Imaging and across the street from Foundations Hospital. So it's a pretty cool location. So far, people are really liking the new building.
I know, I just got a tour when I walked in, and it is swanky looking. I mean, I think of just modern. The floors are just beautiful. Everything is. It has like that new car smell.
New car smell. Still breaking it in. Still moving in, but slowly but surely.
Yeah. So I don't know if you mentioned it. I didn't catch it. But when did you start your practice?
So I've been in practice for about 7 years now.
Okay.
Outside of residency and fellowship, but if you take that into account, then it's been about 10 years.
Nice, awesome. And then you mentioned that you did the fellowship and the residency and all that. And just so that people understand the difference, because I don't think the general population understands. I think they think you go to medical school, you become a physician, and residency and fellowship kind of just loses meaning after that. Could you explain a little bit more about what that means?
So medical school, everyone kind of receives like the same kind of groundwork knowledge for general medicine. then you have to start picking what specialty you're wanting to go into. So whether you want to do dermatology, ophthalmology, or disorders of the eye, or if you want to focus on skin, if you want to become a surgeon, if you want to become a heart specialist, then those require more training than just what's in medical school. Once you graduate medical school, you can become a general practitioner, but you're not necessarily a specialist of any sort. So OBGYNs have to do a residency in OBGYN. Cardiologists have to go to fellowship to study the specifics of the heart. So after medical school, you have this kind of groundwork that you have to build on, and then depending on what specialty you're wanting to do, that's the fellowship or residency that you go into. Residencies can vary from 3 to 7 years. Family medicine is a 3-year residency. Most of the primary care residencies are 3 years, so pediatrics is also 3 years, psychiatry is 3 years. The surgical subspecialties can be anywhere from 4 to 5 years.
So what's the difference between a residency and a fellowship?
So residency is your primary specialty, so internal medicine, psychiatry, pediatrics, family medicine. Fellowship is when you want to take an aspect of that and subspecialize. So you get further training in the heart, you get further training in the GI tract, you get special training in different surgical procedures. In my case, we got more training in the musculoskeletal system, more common sports type injuries, management of those injuries, just dealing in more specifics on a smaller area that you can become more specialized in, as opposed to this broad topic of family medicine where you have tons of medical elements that you study. The fellowship focuses on one of those, and you go into that a lot more in depth.
So that's like super specialist. My understanding is it's like the most specialized that you can get in a specific body area or subject within the medical field.
Right, and that's where the fellowship comes in. And some people will do multiple fellowships to get specialized in very minutia. So like the eye doctor could become a specialist of the retina. So there's different things like that. You have orthopedic surgeons who will become specialists in just the hand.
That's so cool.
So that's the point of fellowship, is just to focus on 1 or 2 areas and expand your knowledge on that, as opposed to just kind of doing broad paintbrush.
So we're going to get into our topic of the day. One of the favorite things for you to talk about is shoulder problems. And, it's definitely a commonly injured body part for people in sports. So tell us about shoulder problems. What got you interested in that?
So it's basically what got me interested in sports medicine in general. It's just trying to deal with, common ailments that athletes, and I use the term athlete loosely, you don't have to be a professional athlete or anything like that to have shoulder pain.
Be like a weekend warrior,
or even just recreational, just dealing with aches that I myself had. I had a shoulder injury a few years back when I fell and dislocated my shoulder, and you never realize how important a body part is until it hurts.
Yes.
So helping people deal with shoulder issues is something that I enjoy, just as my general sports medicine practice, and trying to provide a non-invasive or non-surgical approach to something that can be pretty debilitating. And try to approach it from a vantage point that is just not isolated to the shoulder, but like the whole body in general. So sometimes people will have neck pain that presents with shoulder, or they can have the elbow is the cause of their shoulder pain. So it's not just the shoulder that you have to look at. You have to look at the whole individual. And sometimes when you go to other specialists and you tell them you have shoulder pain, They don't necessarily evaluate the other things that could be masking themselves as shoulder pain. And people go undiagnosed or misdiagnosed for several years. So that's one of the things of, why I was wanting to get into that, so that I can help patients get to the right diagnosis and the right treatment sooner.
Yeah, that's awesome. That's so cool. And so how long have you been focusing on people with shoulder problems? I mean, has that been your whole career pretty much, or was it after the fellowship more so? More so
after the fellowship. I didn't do as much during my family medicine residency, but the little I did do was what sparked my interest to do the fellowship. In my fellowship and then the time since then, so for the past 7-8 years, have been really, really focusing on shoulder issues.
Mm-hmm. And now you said that you help people out with avoiding surgery or alternatives to surgery more so is what you said. What are some of the common problems with shoulders that you see, like some of the more specific diagnoses?
So the most common would be, rotator cuff injuries. That's kind of a catch-all phrase sometimes, but that's, definitely the most common shoulder problem that we see. And rotator cuff issues don't necessarily have to be caused by any, real significant injury or trauma. Someone could just reach for something real quickly or awkwardly rotate their arm a certain way and they develop inflammation of the rotator cuff or a sprain. So not all rotator cuff issues are necessarily tears that require surgery. A lot of times it's a muscle strain or inflammation of a muscle that just needs the right type of treatment. Most of the time that treatment consists a lot of going with someone like you and getting physical therapy. Something when I tell my patients, it's a simple fix, but it's not a quick fix.
Yes.
The exercises aren't very elaborate. You don't have to have a lot of weights or a fancy gym, because people always say, well, I don't have time to go to the gym. It's like, you don't need to go to the gym. You can some of these exercises you can just use your door jam for exercising the muscles of the rotator cuff. But the key is arriving at that right diagnosis so that the appropriate treatment can be applied.
Yeah. And one of the other diagnoses that I commonly see related to rotator cuff tears, and it's, from my understanding, the way that I look at the body, it's more of on a spectrum. And on the lower end of the spectrum, if a rotator cuff tear is like the extreme end, on the other end would be like shoulder impingement. So there's something wrong with the ball and socket joint. Do you get a lot of those people as well?
Yeah, it's definitely a spectrum. It's the impingement, I think, is one of the more overlooked. And the reason why is because a lot of the studies that we use, or a lot of the diagnostic studies that people use nowadays, don't involve, unfortunately, the physical exam. So X-ray, a lot of people will focus on X-ray when people have shoulder pain, and they're like, "Oh, you have nothing," meaning that there's not a break. You may have a little bit of arthritis, but the X-ray is normal. And so the patient's like, "Well, why do I have this pain?" Well, one, muscle doesn't show up on X-ray. Second test that is commonly used is the MRI. The MRI is great for looking at tears. It's great for looking at signs of inflammation, maybe some calcifications in the tendon that cause irritation, but it doesn't allow for you to examine the muscle in movement. And impingement is one of those things where movement is what triggers the symptoms. So the MRI may come back negative because impingement, you're holding still in an MRI. You can't move. So there's no way to appropriately diagnose impingement using MRI. So impingement is more of a clinical diagnosis in terms of certain exams that you do within the visit that trigger that symptom. So that's one of the things that we sports medicine specialists learn in fellowship, are those provocative tests to to elicit that symptom that can't necessarily be visualized with the most common modalities that we have.
Yeah, and that's exactly what I wanted to ask you next. Is what are you doing? You specifically as a sports medicine shoulder specialist, what are you doing that's different than, say, a general doctor? Like, what kind of knowledge or hands-on tests do you do that they wouldn't necessarily know to do?
So, in family medicine, when I was doing my residency, the basic exam that I got was, do they have full range of motion of the shoulder? Are they tender to a particular spot? For impingement and other shoulder issues, there's a slew of tests that can be done to test the rotator cuff. There's one that's called the Job's maneuver, where you're putting pressure on the arm and external rotation, pushing kind of up towards your head. The other one that's called for impingement is the Neer's test. So you kind of put your thumb facing down, and then you kind of elevate your arm close to your ear, so near to the ear. Hawkins test is another test that checks for impingement, where it's kind of like you hold your arm out in front of you, bend your elbow, and you just kind of rotate your arm down towards the floor as you move across your body. So there's different tests that sports medicine specialists have been trained to do that weren't part of my residency training. And a lot of times you got to use multiple tests to isolate the issue, because the longer an issue goes on, other muscles start to get affected and they start to ache and can give you a false positive on some test, and kind of lead you to another direction when it's all coming from the impingement. It's just that it's gone on for so long that the other muscles around it are irritated because they're having to pick up the slack.
Yep.
It's a combination of all those tests. Sometimes I'll do an ultrasound. So that's one of the few, or I think the only one, that you can actually visualize the impingement, because you're actually visualizing the muscle, and then you move the joint, and then you can see the impingement on ultrasound.
That's so cool.
So that's another modality that we can use.
Wow, that's awesome. So, what type of symptoms should people be looking for when they have a shoulder problem? Like, when should they decide to come and see you versus waiting and seeing if it'll pass?
So, I mean, that's a great question, because everyone's going to have aches and pains. It's part of life. You tweak muscles here and there. When it starts affecting your activities of daily living, if you're having trouble getting dressed, putting on your shirt, women having issues strapping the bra, reaching for a cup in the cupboard, turning doorknobs, when it's affecting your activities of daily living, and the symptoms have been going on for about a week or two. Most muscle strains heal within that kind of week or two time frame. But if it's severe pain, if it's pain that's keeping you up at night, if there's any significant weakness or neurological issues, numbness, tingling, burning, then I would definitely come in sooner. But if it's just a pain to the shoulder without significant reduction in the activities of daily living, that 7 to 10 day window is usually good enough for most muscle strains to kind of go away. But if it's persisting past that, then definitely seeing someone would be beneficial.
Yeah. One of the common ones that I hear about all the time is picking up a full pot of coffee to pour their coffee. People always like, gosh, that kills me every morning, and that's when I know my problem still hasn't gone away.
That it could be something as simple as that. I mean, I've had one person that couldn't get their toothpaste because they would have to reach up into the medicine cabinet,
Yeah.
and just that motion of moving their arm up those few degrees was killer.
Yep. Cooking is another one, like chopping. People that have to chop a lot of vegetables, or whatever it is that they're chopping, that forced repetitive. I hear a lot of people complain about that.
Yeah, that too. The people who are able to enjoy their golf days are finally attuned to when their swing goes awry because of the shoulders bothering them.
Yep. And in the sports world, people lifting weights all the time run into shoulder problems, especially with like doing overhead exercises or anything with any shoulder specific exercises.
Right.
Bench press I hear about all the time.
So for people who are on the more athletic side, do more performance, being attuned to your body is key. If there's a gradual loss of weakness on one side to the other that wasn't there before, in someone who trains a lot, needs to be dealt with soon, because those slight weaknesses can actually be a sign of pretty significant muscle damage in someone who's very well built. So someone who has that or notices that should be seen pretty quickly.
Yeah.
For those who are wanting to work out, form is key.
Yep.
You can be doing the right exercise, but if your form is not right, you're going to hurt yourself.
I see that all the time. I agree 100%. So do you have any other helpful information that you want to share with people in El Paso about shoulder problems that they may not otherwise know? Like it's not common knowledge or something that unique that you end up telling patients a lot?
So what I tell patients, particularly, because I'm a huge believer in diet and exercise, and a lot of people think that one, they either have to go to the gym or have a lot of fancy equipment to do the exercises, but in terms of shoulder, they're very basic, simple exercises that for the actual intrinsic rotator cuff muscles don't require a whole lot of heavy weights or machines. It's mostly a lot of range of motion and an appropriate range of motion. So just because you go to and I get this a lot for people when I try to refer them for physical therapy, is like, well, I go to the gym 3-4 times a day, I'm already doing exercise. Yeah, you're doing exercises, but you're doing exercises, one, for more of a general kind of well-being of the body, and usually more geared towards muscle building or muscle toning. The exercises for shoulder injury or any musculoskeletal injury are more geared to taking away the inflammation or muscle strain from the smaller intrinsic muscles that oftentimes get overlooked when you're going to the gym and curling or bench pressing that are focused more on the larger muscle groups. Physical therapy is something that focuses on the intrinsic muscles that help stabilize the joints better, that don't necessarily make you look it doesn't add to the curb appeal, but it just helps mitigate the pain by assuring more proper alignment of the muscles and joints.
Yeah. I always have people that whenever I talk to them about working out a rotator cuff muscle, I tell them this: you'll feel somewhat of a burn, but it's not going to be like if you go work out your biceps or triceps. And then you're never going to have the muscle burn where you look in the mirror and flex and everybody's like, look at this rotator cuff back here. It's just popping out like crazy.
Yeah, because everyone, people go to the gym to focus on muscle building or improving their physique.
Yeah.
The exercises for rotator cuff, the emphasis is not on improving your physique, it's on improving your pain. Which will down the line allow you to improve your physique by letting you do the exercises that you're more wanting to do. These exercises are needed to help prevent injury when you're doing those other more strenuous heavy lifting type exercises.
And for the rotator cuff muscles, just to talk about that a little bit, because that's a super common problem area for a lot of shoulder problems. There's 4 of them. We don't have to go into the names. You can certainly Google them, but they all pull in different directions, and they help to connect the ball onto the socket in the shoulder joint. And so as a physical therapist, finding the exact direction and motion that is the weakness or that is the main problem area, or knowing which rotator cuff tendon is injured is also part of the problem. So it's not as when we talk about doing shoulder exercises, rotator cuff exercises, it's not always like the same one that's going to help every person.
Right,
it could be a different one.
Because with there being the 4 major muscles that make up the rotator cuff, not everyone's going to be injured in the same muscle. And like you said, each muscle has their own action. One of the muscles rotates your arm outside, another one rotates it inside, another one lifts it above your head, and then depending on what degree you're in, multiple muscles are working at the same time to give you that same benefit. So that's where when we talked about what exams to do for shoulder pain evaluation is trying to isolate that muscle in a particular movement or test that elicits that symptom. So the same exercises don't work for everybody because not everybody injures the same rotator cuff muscle. Even though we dump it in the catch-all phrase of rotator cuff injury. Yeah. But rotator cuff injury can be a slew of different things because there's the four major muscles, and then you have all those other smaller intrinsic muscles that can still be, or ligaments that can be injured.
The biceps tendon, I always hear about that, or see that injured.
Yeah, bicep tendon is pretty common. You got ligaments in that combine or not combine, but hold the humerus and the shoulder together. That are really small ligaments that can be a cause of posterior shoulder pain or pain on the back side of the shoulder that aren't necessarily muscle related. It's a ligament that attaches or holds two joints together. Every rotator cuff injury is different and therefore needs different a set of different exercises to kind of work through.
Yep. Cool. Well, this has been great talk about the shoulder today. So do you have anything else that you think you want to share with El Pasoans about shoulder problems or your company or just in general about anything else you can help us with?
Yeah, so we're here, like I said, on the corner of George Theater and Physicians, 11851 Physicians Drive, to help you with any sports medicine or musculoskeletal injuries. We also SculpSure, vast array of other things, general family medicine issues. So we see anywhere from kids to adults. For people who do a lot of working out, trying to lose weight, we offer weight management education and help with weight management in terms of medication and diet nutrition counseling.
That's awesome.
For people who have problem areas that they want to get rid of, love handles or things like that. We have some aesthetic procedures that we offer. SculpSure is a non-invasive way to kind of lose the fat in those problem areas that aren't responding to diet and exercise. It's not a substitute for diet and exercise, so it's just for people who have those problem areas that they just can't get rid of, that we can give you that added assistance with the SculpSure.
Amen to that. Problem areas. I know very well about that. Well, cool. So if someone in El Paso wants to learn more about your clinic, Dr. Garcia, or even maybe make an appointment, what's the best way for them to get in touch with you?
So they can call us here at the clinic, 915-493-6646. We have a Facebook page, and they can just search El Paso Center for Family and Sports Medicine. They can reach out to us on our website, and they can actually book through our website at El Paso Center Family and SportsMed.com. And there's a link there that you can actually book online if for whatever reason you're trying to book an appointment after hours or over the weekend. So those are the three main ways to get a hold of us. Awesome.
Great information today. Thank you so much for taking the time to talk with us. I really appreciate it. I think all Pasoans are going to benefit from this time and time again as this podcast is available. So if that's it, then we'll close it out. Thank you so much.
Thanks for having me. Thank you. Appreciate it.
Absolutely.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, Please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.